I often tell patients, please don't make your goal, I want to lose weight. Make it, I just want to do something healthy for myself every day. Because then you're going to achieve it. And you're going to wake up every day and smash it. And you're going to feel really positive. You're going to look at the day and go, I did that. Whereas if every day you wake up and go, I just want to be thinner. And by the way, I don't want women to be thin. I want them to be strong. My constant mantra is get strong. Don't get skinny.
Yeah.
Especially at midlife, as we're losing our muscle mass, as menopause kicks in, as we lose our estrogen. So many things are happening to women.
Welcome back to the Health Review podcast, part of thehealthreview.com, your go-to source for all things health and wellness. I'm your host, Emily Rose Adams, and in this episode, we're thrilled to welcome Dr. Reem Al-Shaikh, a highly experienced GP and women's health expert. With nearly 20 years of experience in the NHS and as the co-founder of the Women's Wellness Clinic, Dr. Reem brings a wealth of knowledge to the table. But she's not just a doctor, she's deeply passionate about empowering her patients through lifestyle interventions, focusing on diet, exercise, and holistic health. In our conversation today, Dr. Reem shares practical strategies for incorporating better health practices into your daily life, offering inspiration and actionable advice. This is definitely an episode you don't want to miss. So please join me in welcoming Dr. Reem Al-Shaikh to the show. Thank you so much for coming on.
Pleasure.
I'm so happy. Obviously, not only are you an amazing GP, women's health expert, but you are also my sister-in-law and one of my favorite people on the planet. So I felt like it was only right to get you on and just talk about your knowledge. I feel like I'm very lucky to have you so close to me because I make those phone calls to you sometimes when I've got my own health issues going on. So
always welcome.
I wanted to share your wisdom with everyone. Reem, you are so knowledgeable as a GP. I feel like you know everything.
Not entirely true, but I like to try and always give a balanced view on what everyone's asking me, which is often lots of questions about health and well-being. And, I think it's really interesting doing what I do because you just learn so much from people. And a lot of what I learn is not necessarily what I learned at medical school. So I'm glad that I'm of use.
That's true. And also what I find really inspirational about you is that you're also really into health yourself, which is not always the case with GPs and doctors.
True.
And now, you're on a mission to help women. You've opened your own women's wellness clinic with another partner. Yep. How is it going? And what's your mission at the moment to help women?
So I co-found Women's Wellness Clinic, which I think the mission really for us is just providing what we already provide within the NHS, which I like to believe is just excellent healthcare, the best I can offer with the resources that I have. And I think within the private sector, the resources are different. I don't actually think I want women to understand that I don't think they get a different version of me. I'm not going to tell them anything specially different if they're coming to see me privately compared to coming to see me in the NHS. But, the gift of time and having more time and being able to kind of really get into the nitty gritty of someone's kind of situation or health presentation. When I look at women, when I look at my patients, I am not looking at just the problem they present to me. I'm looking at their healthcare journey over the next decade, maybe over the next 2 decades. And so I think, what I might be able to achieve in a number of appointments in my NHS life, I might be able to achieve in just one sitting in the private sector. And I think, from a mission perspective, I just want to do the best for women. I want them to understand their health. I want them to understand their journey, their choices. And I want them to kind of feel really empowered to take their health into their own hands. And if part of my kind of offering is a bit of cheerleading, a bit of advice, a bit of support along that journey, then I'm super happy that I've actually achieved what I want to achieve. Wouldn't it be great if I could make everyone in this nation super healthy and really aware of their health? And I think that's an amazing kind of aspiration. But actually what I can do is improve the health journey of the people that I meet. And that's what I'm trying to do.
And before we go into more detail about what you're doing, I'm interested to know, I think you're really inspirational with your health routines yourself. You're getting up at the crack of dawn, you're going to CrossFit. Can you go into more detail about how you're doing that?
I absolutely can. So I think what's really important to say is, if anyone who's met me or known me for a long time, I'm a super hyperactive person. I've always been this way. Like, I was a running joke at medical school and any hospital job I've ever had, that I'm always like, this is me. Okay, this is just me. And if you've met me in my consulting room, you understand that I'm always a bit perky. And I think that helps me get through my day. And I can sign up to things, and I can be a little bit sometimes faddy about what I start to do, and I kind of get tired and bored easily. But I think that from my own health journey at the moment, I am really trying hard. I am absolutely never used to be a morning person, and now I'm really trying to get enough sleep so that I can wake up when my alarm goes off at 5:40. That's the time I get up. I'm not quite in the 5 a.m. crew where people get everything done before 6. I'm not quite there yet, but I get up and I work out. And what's really interesting for me is that kind of journey into regular, consistent exercise has really helped my brain. It really helps me deal with the day ahead. So I work out in a CrossFit gym. CrossFit is effectively functional fitness training, and I'm a woman in her midlife. I'm in my perimenopause, and it's really important to strength train. And this was my way into doing that, because I was finding the motivation to do that on my own quite difficult. So I get up, and minimum 3 times a week, and to be honest, most of the time it's 4 times a week, where I'm doing that sort of guided exercise, whether it's a bit of HIIT and strength training, weight training in a group setting. And I'm pretty sociable, so it kind of plays into my kind of strength. I have a laugh, and I've overcome my own fears of not being the best at everything. I think it's quite hard. When you're starting out in your exercise journey, that fear is always, I'm going to be in the class and I'm going to be worst, or I'm used to a bit type A, I'm used to kind of knowing a lot about everything. And then you go and you think, oh, I don't want to be rubbish, so I don't want to go. And I realize that I'm only competing with myself and nobody else. And I'm getting stronger, and I love that. But I cannot stress enough how much the consistency in my exercise kind of routine is helping my brain. It helps me be less stressed. I'm more focused with my patients. I feel more available to my team, more supportive to those around me every day. It's amazing. And it's becoming a bit of a non-negotiable, as in, I can meet you after work, but I have to wake up. So that's going to alter what time I might want to stay late till, or stay out to dinner till, or I might say no to an invitation, because actually I think, no, tomorrow I've got to do my exercise, and that's my goal, that's my focus. And I'm really mindful of trying to make decisions throughout my week and day that get me closer to my goal, if that makes sense. So that the exercise is big, it's a really big change, and a really kind of bit of a labor of love at the moment, as to, I'm really finding that it's something that really helps me.
And I remember you saying that, because in a lot of GP practices you'll have the nurses and other doctors who've made cakes and they bring it in, and I remember you saying to me, since I've upped my exercise regime, I'm feeling like I don't need that, I don't want it. You don't get that crash, you're making better choices with your own food, you're preparing 100%. Stuff. But I think, do you know what, this is so important with your patients, because I think you've also got a treadmill.
I do.
By your desk.
So I have a few things. So I have a standing desk, and that really helps me, because I like to stand a lot, and it helps me when I'm moving, when I'm talking to patients on the phone. I like to kind of, be kind of, I like to kind of feel like I am relaxed. And I found that when I sat all day, and as a doctor, you can, especially in a primary care setting as a GP, you can sit for 12 hours in a day. You might get up and do a wee, or you might get up and like go and have lunch, or whatever you're going to do. But sitting all day kind of made me depressed, and I ate more, and I felt a bit sluggish. And I find when I'm up, it's better. I do have a treadmill that I can walk on. And I mean, don't get me wrong, when you're in front of me as a patient in my room, I'm not walking on a treadmill while I'm talking to you, like move it out the way. But that's really helped me, because it's tricky to sometimes leave the building with what I do. And in the middle of the day, I still have to be around and available to those who need me. So it's hard for me to go out and just have a walk. So I kind of have to arrive at work having done my exercise, which is why I get up early. Treadmill in the room. I even have a weighted vest hung on my door.
That's
and I'll
amazing.
Often be walking around the building wearing my weighted vest. Really good for bone protection, really good as a kind of a bit of extra pressure on your spine. It's good for bone turnover. Again, I'm mindful of where I am in my life and journey, and I want to be strong. And what's really lovely is that patients see it, and then they go, oh, what's that? How come you're doing that? Do I need that? And I'm really trying to lead by example. You know, a lot of my patients say, oh, I work from home. It's really hard. I'm not doing enough exercise. And, you know, my first response is, well, you know, could you commute to work? Could you get up every day, get dressed, go out your front door and commute 10 or 15 minutes, whether that's a run, a jog, a cycle, whatever you want it to be, and arrive at work, arrive at your front door ready to work. You can get the exercise in. You just have to be in the right mindset. And I just found that actually more and more I wasn't getting my steps in. I wasn't doing all the things that made me feel good. And so I just looked at my office and said, well, what can I do? What's in my hands? What can I change? And, you know, good days and bad days. Sometimes I use the equipment more than the others, but it's really helped me. And it really kind of, I think, as an example set, shows my patients, look, there are different ways of doing this. Here's one way. Look, I'm trying too. And I quite like that I'm going on my health journey, and I love sharing that with patients. I love saying, well, I tried this and this worked for me. Could this work for you? Or what have you tried? Oh my God, I'm going to try that. You know, one of my hacks at the moment, trying not to drink too much caffeine. It really messes up my sleep.
You're a coffee addict.
I am a coffee addict. Anyone who knows me knows that. I mean, my secret Santa
we
gift
spent Christmas
coffee
with you, and I just remember, like, it was something like 11 a.m. and you've had already 4 coffees.
Okay, that doesn't make me look too good. So I think what I would say is we all have addictive parts of our brains.
Absolutely.
And coffee is very much my dopamine hit.
Yes.
That's it. That's my big
But it's
vice.
not necessarily unhealthy. The jury's very much out on caffeine. I guess it's the sleep that we have to prioritize.
Absolutely. And I know when I have more caffeine, I'm definitely more disrupted with regards to my sleep, especially later in the day. So now it's just about habits. You know, I get up and I have my rituals. So before I've got, you know, out the door to my gym class in CrossFit, I've made my canister of herbal tea. Like, everyone laughs at me. I turn up at work with a camping flask full of herbal tea, because I realize that for me, a lot of the coffee drinking is just the desire to want to just have a sip of something, to move, to help me think. It's like a moment, and it doesn't have to be caffeine. So I have my little herbal tea flask, have my protein, you know, I've got my little pot with my vitamins that I might want to take at lunch, and I sort myself out so that I'm arriving to my place of work having done what I need to do for myself and prepared. I'm gonna get hungry. What's my meal? You know, I might want a snack. Do I have them ready? Do I have the types of things that I know I want in that moment when I want it? Because if I don't, as you mentioned, there are cakes and biscuits absolutely everywhere. If you go to any healthcare setting, and by the way, patients, we love it when you give us things. So please don't, you know, don't stop. But effectively, you know, they tend to be treats. And, you know, if you're starving, you'll eat what's in front of you.
Absolutely.
And I know that I'll get my little glucose spike, my sugar high. And then very quickly after that comes the crash. And then, you know, if you've got a 12-hour day, I just can't really afford that lull. And I need to be focused.
But that's the thing. I mean, your schedule, you know, as GPs in the UK, like, it's no joke. You're seeing back-to-back patients. You're doing at least 12-hour days. You're getting home late at night. So I guess the amount of organization that you need to make these things happen is quite high compared to other people in other career
Absolutely.
paths.
But what I'm learning is it's not that hard. You know, like, I think I'm busy. Everyone's busy. I think, you know, we all suffer from busy life syndrome. A lot of my patients, specifically women in midlife, you know, they are juggling work, maybe children, maybe elderly, unwell parents, a partner, you know, colleagues at work. You know, again, if you have kids, emails from the school. If you don't have kids, 101 other commitments you signed up to. So we're all really, 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 really busy. And there's no competition there. You know, I don't sit with my patients and say, well, look, I can do it and I'm busier than you. Because how do I know I'm busier than them? I don't know that. But I think it's about saying, I prioritize my health because I can't be a good doctor. I can't be a good mom, a good colleague, a good friend, a good anything if I'm not healthy. And I think what's changed, especially I would say since I hit my 40s, is going, do you know what? I choose my health before anything. And I want a happy, long, joyful life where I can move, I can function, I can think. I want to be as well as I can be. And we're living longer. And I think, you know, women do live longer than men, but they actually statistically live in poorer health. And I don't want to be that. I don't want to get to 80 and not be able to move. I don't want to get to 80 and not be able to pick something up and put it in a cupboard ahead of me. I want to have all my function and my faculties. And so I look at myself now and I say, well, am I laying down the right foundations, and how do I go about doing that? And for me, it's really tricky, with patients to kind of get everyone to get everything perfect and right all the time. And you can't. And every day is a challenge, and you don't do everything as you perfectly want to do it every single day, whether that's nutrition, exercise, sleep, as you've touched on. So many things need to be optimal. But if we just do the best we can every single day, and our mindset is, I'm doing this to be healthy, I'm not doing this to be thin, I'm not doing this to lose weight. I really get frustrated when, especially my women, their goal is something that I think is really, it's really sad, because it's very often, not always, but can be very much about their aesthetic. The world views me as X, and therefore I need to be Y. And I'm like, but is that what you really want? I often tell patients, please don't make your goal, I want to lose weight. Make it, I just want to do something healthy for myself every day. Because then you're going to achieve it. And you're going to wake up every day and smash it. And you're going to feel really positive. You're going to look at the day and go, I did that. Whereas if every day you wake up and go, I just want to be thinner. And by the way, I don't want women to be thin. I want them to be strong. My constant mantra is get strong, don't get skinny.
Yeah.
Especially at midlife, as we're losing our muscle mass, as menopause kicks in, as we lose our estrogen. So many things are happening to women. And I think that, we're really unkind to ourselves. I'm focusing a little bit too much on women, but the reality here is women are we were so bad at putting so much pressure on ourselves to just do everything as the world wants it done.
Yeah.
And I really want my patients to understand that, I just want them to look ahead and say, what you're deciding to do today is not only going to affect you today, it's going to affect you in 5 years and in 10 years. And how can we get better choices? How can we help support and shape, your healthy habits, the way your family acts as a unit, how you eat, how you move, what your kind of sleep patterns are? Because, everyone always thinks, oh, it's going to be better tomorrow. And then tomorrow doesn't come.
Yeah.
And so,
but I think this is so important. What you're doing is so important for your patients, because traditionally, I think, obviously not all GPs, but it felt like a lot of doctors weren't sort of sharing that message.
Yep.
Now, I think it's probably more common. But from my experience, I went through a period of having chronic UTIs for a long, long time, turned into kidney infections or antibiotics. And I went to see a urologist. And I remember saying to this urologist, look, I've done this for years and I'm so sick of it and I just need this to end.
Yep.
And he was going to do like a surgery on me. And I said, I'm going to just try and just quit alcohol, because I was drinking regularly enough where it was causing issues. And his reaction was like a knee-jerk reaction. He said, why would you do that? And I said, well, because we know like alcohol obviously isn't good for, your bladder and kidneys and your overall health. So I just want to give it a go. And he said, I think it's a bad idea, because alcohol, if you just have a little bit, on a regular basis, it will actually relax you. And I think what you might find is you'll be more stressed if you quit alcohol. And I remember just thinking, this is ludicrous. He's a consultant, and should be advising a whole sort of holistic approach to lifestyle. And this is the approach that you're taking. And I'm sure it's been extremely beneficial for your patients.
I think what I'd say is that just because the person you're seeing is a healthcare professional, it doesn't mean that they are, let's say, living a super healthy life. So I think that's challenging, isn't it? Because if you're selling healthcare and you yourself don't buy into having a good, healthy life, that's a bit weird, isn't it? You kind of go, well, that's odd. If you were paying and buying it, and what I'd say within the UK is obviously the National Health Service, it's free, but, we pay it in our taxes. It's you're going to want to spend time with a professional who's, an expert in their field, don't get me wrong, who understands the latest guidelines, treatments, studies, etc. I think where lifestyle medicine comes in. And so lifestyle medicine has a number of names. It's sort of functional medicine, lifestyle medicine, holistic medicine. But what I would say is, how can we question eating well, sleeping well, avoiding chemicals in our diets, ultra-processed foods, doing more activity, spending less time on the screen? How can we question that even begin to question that might not be the right approach for every single patient. And then we've got other well-studied evidence-based things. We've got drugs, we've got surgery. So
which is absolutely needed
absolutely
at the right time.
And so you're a young woman and you're saying, okay, well, if I change something about what I do in my diet, will this in any way improve my symptoms? And wouldn't it be sensible if I did this non-invasive, really super healthy thing for myself first before I commit to any kind of surgical intervention or prescription medication? And so I just think that's the right approach. And what I would share with you is that, you know, we are, as doctors, we're scientists. We are the communicators of research. We're not necessarily the ones doing it. We're not necessarily the ones in the lab working out the right drug for you. But our job is to look at all the information, evidence, drugs, treatments out there, and then find the best way of communicating that to you as a patient. That's how I see my job as a GP. I look at myself as being a communicator of health. You know, if I can explain it to you in a way you understand, you're more likely to engage with whatever it is that I think with you as a shared decision is right for you and your health. Okay. And so what I would say is that, you know, you might look at a guideline for a disease or a condition, and then, you know, lots of studies have been done, but think about that for a second. Lots of studies have been done on a drug because a drug company needs to make money. And don't get me wrong, there are many drugs that save people's lives, but there are many drugs that I think people want and ask for because it just seems a little easier than actually having to go, how am I going to, in my chaos of my life, figure out food, sleep, exercise, sorting out the family, dealing with the teenager when I say, look, I don't think we should all be on our screens at night, but when you're tired and you get home and people, you know, women especially, what do? They open that bottle of wine and before they know it, they've drunk it. And before they know it, they're actually, believe it or not, functioning alcoholics where they're drinking way over the recommended amount of alcohol per week because it's just become an easy habit. It's, you know, people often cook whilst drinking and it can slip into then poor sleep or weight gain or depressed mood and irritability. And you can see how that it's all really tricky to unpick and change. And it's also, I think, as a clinician myself, sometimes really hard to say to a patient, do you know what? I think what we need to actually work out together is all of this stuff. And I don't have any influence over that. I can't show you a study all the time that says, if you eat like this, sleep like this, and do all of the things I'm saying, you're going to feel better. But, you know, I've got a study that says if you do this surgery or this drug, it's probably going to fix this one thing. But then there's all these other things that are kind of layering on top. And so I think a lot of doctors will say, sadly, I think, oh, the evidence doesn't say that that's going to help. So that urologist probably thought, well, I don't have a scientific trial that says if you quit alcohol that this particular thing's going to get better. But I've got enough evidence to tell you that this drug's going to work, or this procedure that I'm going to do that you're probably going to pay for is going to work. And so, again, I think as patients, now in 2025, more than ever, you need to navigate for yourself. You need to be bold enough to say, what about this? Or I've read this. I think health is changing. It frustrates me. And it's really tricky. You know, you have to remember when I'm in the NHS, I'm spending your money. I'm using government money. So I cannot be recommending things that are wild and off-piste without evidence. I can't be prescribing things that don't have evidence associated with it because there's not, you know, this is National Health Service money. But a lot of what I'm trying to prescribe in a way to my patients is this inspirational idea of, could we do something where actually the drug or, you know, isn't the thing we're going to go to, or the drug might be something that supports you as a tool to get you to where I think we want to get you, which is feeling motivated, let's say, to get up and exercise. Weight loss drugs are a great example of this. You know, they're everywhere. And they should be, and I think they are good drugs. And I think for many patients, they are the tool that are going to help them kind of move forward in their lives. But that prescription needs support, guidance, nutrition, kind of exercise
and
support.
perhaps a long-term plan behind it. So what you're saying here is, if someone's displaying, maybe they're overweight and depressed, can't quite find the motivation to exercise, to lose the weight, to get healthier and feel better, you're saying perhaps you would prescribe an antidepressant to get them to the point where they can actually start exercising, and that will lead to, and so that's an example of, I guess, how the medication can help.
Yeah. think we're at a stage where I think a lot of classically trained doctors, and what I mean is you go to medical school and you do your degree, and you might even do a second degree. A lot of us come out of medical school with more than just our medical training and our medical degree. We might have done Bachelor of Science degrees or Masters or PhDs. There's all these kind of collect all your accolades, but it's very traditional teaching. Don't get me wrong, it's essential. I need to know how your body works. I need to know what the ins and outs of what the organs do and how they communicate. But you don't necessarily leave medical school understanding what it is to be healthy. You are, as a doctor, when I qualify as a doctor, I am an expert of diseases, of the functionality of the human body and disease. But I'm not necessarily an expert of health. And to some extent, I've been on my own journey. Like I qualified as a doctor nearly 19 and a bit years ago. So I've nearly been a doctor for 20 years. And I've worked that whole time, no breaks. The only break I took was, I've got 2 kids and I took 6 months off with each of them. And so that was it. It's the only time I was away from my job. And even then, if you know me, I was still kind of going to meetings with my babies and doing all those things. And so, you know, I did what I needed to do. But effectively, I've learned about being healthier through the job I do, through interactions with my patients, through my own journey, my own self-reading. So I didn't learn a lot of what I'm teaching my patients around nutrition, around menopause care and hormones and, you know, menopause hormone treatment and exercise and muscle building and the importance of kind of longevity and how we get to longevity. You know, a lot of what I'm actually really excited about sharing with my patients and I work with my patients on, I didn't learn at medical school. I have all the wealth of knowledge that I understand your body and I understand disease and I understand how everything affects, you know, one thing affects the other. But health itself, I know it sounds crazy, it's kind of like a journey and I have a desire to want to know about it.
Yeah.
But not everyone necessarily does. And I don't get me wrong, you know, I believe that all doctors want to do a good job. You know, the urologists thought they were doing a really good job with you. They're offering you the best care. I do believe that, you know, in general, doctors, paramedics, nurses, whichever professional you meet, they're doing the best they can with you. But I think we can do better.
Yeah.
And I think as a population, you know, looking ahead, we're pretty, in general, unhealthy. And I think we live in this environment that's really distracting, from, you know, distractions online to all these great things that we have in our lives that, you know, Netflix on demand. You know, I was a little kid in, you know, the 80s and I remember dreaming about, wouldn't it be amazing if we could press pause on the TV? You know, I remember this crazy idea. It was almost as crazy.
I remember in the breaks, you'd run to the toilet
literally,
and get your
you
snack
know,
and
if you
missed
it, you missed it. And, you know, if you didn't see that one episode of whatever it was, like Neighbours or Home and Away, and, you know, you had to either be unwell in the day to see it again at 1 o'clock, whatever time it was reshown. So, you know, we live in this world now where everything's on demand. We've got all these great things, but they disrupt our sleep.
Yes.
We've got so much access to quick and convenient food. It allows people to eat at their desks, eat in the car. I mean, the UK is amazing, right? You can buy amazingly healthy food anywhere and yet amazingly unhealthy food anywhere.
You also see people at the gym watching Netflix as they're working out. And I get that. Like sometimes on the treadmill, it's boring.
But you never stop to just think. Your brain needs a rest, and don't get me wrong, sleep is part of that repair. We know that sleep's really important because sleep helps us, our bodily systems, our cells repair and recover. But our brains, from a dopamine perspective, also need to just sometimes just look out the window and feel a bit bored, or look at the wall in the gym whilst, if you choose to go and use a treadmill, you're on it. It's like, allow your brain to just have a moment's rest. You don't need to be stimulated all the time. And we do live with this really tricky environment that's amazing, but it's obesogenic. You know, it's easy to get overweight because it's just everything, you know, there's never a moment where you're allowed to feel hungry. I see it with kids. I see it with my patients, you know, like really worried mums. But then we're a nation of snacking. You know, the UK likes to snack.
But we were told that. Do you remember? That you should be having
Snack
however
time!
many X amounts of small meals a day, just never ending eating, basically.
And so what's really hard is, you know, again, I sort of bring it back to the women I see, is they sort of hit menopause and midlife and suddenly are going, oh, hang on now, all these things that I've been doing my whole life, I'm still doing them, but I'm now feeling all these symptoms. What the hell's going on? And as their hormones are changing, their kind of way of being doesn't work anymore. And I do feel for patients in the sense that it's really hard. It's really hard to navigate through all the health information that's out there. You know, there's so much information that we're giving you as doctors, that social media is giving you, that, you know, newspapers, whatever it is you're reading is giving you. You walk into a supermarket and you've got a packet of something that I would consider not even to be food, telling you it's really healthy, and people just assume it's healthy. And I think it is a really difficult time. And I think, you know, the one thing I could say to anyone is just going back to basics is the most important thing. The basics are, you know, do you sleep? And if not, how do we improve your sleep environment? What are you putting in your engine? What's your fuel? You know, is your fuel really good quality whole food? And if you don't know what that means, it's like, I always joke and I say, you know, imagine you look at your garden, and I want you to think, what would grow in this beautiful sunny garden? Maybe it's even in the Mediterranean. Talk about the Mediterranean diet, a lot of evidence for that way of eating. And I say, well, you know, if a packet of frozen chips wouldn't grow in that garden, then it's probably not something you want to be eating all the time.
Yeah.
I'm all right with people eating things here and there, but, you know, you're starting to think, could you grow it? Could you rear it? Could you ferment it? You know, would you be able to plow the field and eat it? And actually, things that are really heavily processed are probably not great. Now, don't get me wrong, we need to process, you know, industrial processed milk so that we don't get sick. That's different. But, you know, a lot of what we're consuming is not good for our brains. It's not good for our bodies. It's not good for so many aspects of our health. And then coming back to the reality of, you know, watching a bunch of professionals have lunch. You know, a lot of healthcare professionals are eating it too, because they too are stressed and busy and trying to make ends, you know, trying to get through their day. And and if you go into a hospital, by the way, in the UK, there'll always be a fast food joint.
I know.
There will always be.
And the food that you get after a surgery or something is...
Don't get me started.
Not good.
You know, eating in hospitals not great. I mean, it's the food we're serving is, you know, to some intents and purposes cheap. Yeah. Because you've got to feed a lot of people, but it's not super healthy.
No.
Often it's highly processed. There won't be a lot of protein. If you think about elderly patients who have fallen and broken their hip, they need a lot of good quality, high-grade protein in their diet to recover and recuperate, and that's not what we're able to feed them in hospital. And so I could talk about this for hours, but, you know, I think food is something that is just so important. And the basics, you know, I wish that I could prescribe cooking classes to my patients. You know, I can give them health information, but a lot of people don't have the skill. They haven't grown up watching generations of their family cook from fresh. You know, they've gone to places where everything is frozen, and frozen doesn't mean bad, but it's not understanding how to take maybe a vegetable, peel it, chop it, boil it, whatever it might be. They just don't have the skills. And what's really hard is when we're saying, oh, we want you to eat this, this, and this, and then you've got all these great companies selling whole foods, organic foods, we'll deliver it to your door, it's already easy to put together. That's really expensive. So if you've got, like, you know, 7 people in the household to feed and you're not earning that much money, you can't access a lot of these companies delivered to your door meals. But you can buy vegetables quite cheaply, and it's, you know, but you've got to know how to prepare them, and it's there's so much, I think, that's a bit broken in our society around this, that I wish I could fix that bit. I can give the information, I could try and get my patients to be thinking about it and believe they can do it, because I know they can make changes that are affordable and will benefit themselves, their families. But it's hard, and I empathize with people, because, you know, every day is pretty hard.
But this is why I think it's great that people like you know, will speak and do podcasts, and hopefully can get a platform to share this message, see your patients, you know, show them the lifestyle aspect of how much that's helped you, and hopefully you can inspire your patients, and I'm sure you are on a daily basis. I would like to ask you about women's health issues, because to me it feels like this is a really, I don't know if it's a growing issue because of our lifestyles. I don't know if you've noticed, since you've been a practicing GP for nearly 20 years, I don't know if you've seen that there are more cases of women coming in with PCOS, endometriosis.
Yes, there are.
Okay, interesting. But why do we think that's happening? And what are the kind of most pressing issues that you're facing with your patients on that?
Okay, so I think first of all, on sort of PCOS, endometriosis. So these are conditions that women can develop, and they can have a whole host of metabolic problems associated with them. And in the case of endometriosis is when the simplest way of describing it is when the tissue inside the lining of the womb, which is, ideally should just stay within the womb itself. And it's very hormonally driven tissue. So it changes. You can get pain and symptoms when it's being kind of, encouraged by your hormones to twist and turn and change. It can grow outside of the womb and other places. It can affect your bowels. It can affect your urine. It can give you really horrendous pain. You can have sexual dysfunction, meaning that, sex can be painful. Intimacy can be really hard. I think endometriosis is a really tricky condition because it's underdiagnosed. We know a lot of women have it. I think there's been so much good work around basically raising the profile of it. So I think we're seeing more of it because we are better at diagnosing it and we're thinking about it. However, what's really sad about endometriosis, and I would even say polycystic ovarian syndrome, so polycystic PCOS, is a condition where effectively you can get really abnormal levels of your hormones. And that can lead to a whole host of problems. It can make you more likely to have type 2 diabetes. Not every woman with PCOS is overweight, but we're definitely seeing more PCOS because obesity is rising. We are bigger now than we were 10 years ago. I mean, there's some great stuff online. I'm a bit obsessed with clothes and fashion, but if you look at what a size 10 skirt looked like in 1950, 1960, 1979, and so forth, size 10 over the years has got bigger.
Wow, that's interesting.
So we as a population are bigger. We're having bigger babies. We are just bigger. And I'm positive that part of that is the access to food, the food industry. We're not going starving, we're not hunting, we're not going for days looking for food. It's just on demand. And so as we get bigger, PCOS is more likely. And so I think we're seeing it more, we're diagnosing it more, but actually these conditions can present with really vague symptoms. And I think there's a real problem in healthcare all over, not just the UK, where women are perceived to be just whiny,
The tough it out mentality.
Oh my God, she's so moany. Oh, she's like complaining of like pain. And like, I think, sometimes doctors are like, oh, I just don't know why she's in pain. Take some pain relief. Or she keeps coming. A lot of women with endometriosis, it's so sad. They present so many times to healthcare professionals. And eventually, they might have a scan that shows the problem. Or they might have surgery where they go, oh my God, I had a patient recently. And she said, we really had to fight for her to be seen by an endometriosis specialist. And it wasn't really, in her case, until they were operating where they went, oh my God, it's so much worse than we thought. We were finding things that they didn't believe that she had.
Right.
And it was through that surgery that a lot, not all, but a lot of her symptoms improved. But this is like years of dealing with symptoms. And I think, menstrual cycle particularly, women lose days off work through heavy menstrual periods, so heavy bleeding, painful bleeding. And, women might choose different careers and jobs and working patterns because of this. And I think culturally we've just kind of come to say, oh, you just got to get on with it. Like, this happens to you. Women get periods. What's the big deal? And I think the answer is it can be a really big deal. And I think women don't necessarily come and tell us. The amount of women I find in menopause who come to me, they come to me at midlife. So I'm talking about kind of women in their sort of 45 plus. And they'll say, actually, in a nice way, I've looked at all this stuff and I think I've got perimenopausal symptoms. Come and tell me about it. And you'll do a whole load of blood work because remember, they are more than just their hormones. I'm thinking about the whole person, not just the fact they're a woman in her menopause. And I'll go, oh my God, your iron is 3. That's low. That's bad. Your ferritin level is 3. And I'll be like, well, either you're not eating iron, you're not absorbing iron, or you're losing it, you must be bleeding. And they'll come and say, well, no, I'm definitely, I don't have a special diet and I've not got any other symptoms. And I'll say, okay, cool. So you don't think you've got any of these reasons why your iron's low. Tell me about your bleeding. Tell me about it. And I'll ask really specific questions. So, are you using tampons, using cups, pads, period pants? Tell me what you use. On a heavy day, what does that look like? And they'll come and say, well, I might change my tampon on my pad every 30 minutes for the first 3 days and I can't really go out. And I'll be like, That's why your iron's low. You're really heavy bleeding. You know, how long has that happened? And I'll just go, oh, it's always been like that. Why haven't you told anyone? Well, I just thought it was normal. And then you'll go, but you know, this is why you're fatigued. This is why you've got restless legs. This is why you've got brain fog. This is why you're irritable. This is why you're not sleeping. And don't get me wrong, on top of that, you might be in your menopause, but we need to sort this out. And I think women themselves are stoic. And I think we are amazing. And I think we put up with so much. So don't get me wrong, stoicism is great. But we're really good at suffering.
Yes.
Because the world has created this sense that we must suffer as women. You know, women are less invested in healthcare.
It's really sad.
It's sad, but it's true. You know, if you look at COVID in the UK and you look at how elective surgery, this means non-cancer surgery, not you've broken your leg, you need surgery. This is surgery that's been planned for. And you look at how hospitals managed delaying operations and what surgery tends to get pushed back more than the others. And women's health especially often gets delayed. Gynecological surgery for prolapses. This is when, you know, a woman's dealing with horrendous symptoms on a daily basis of, you know, her organs not being in quite the right place or her muscles not being in quite the right place. It can affect her sexual function. It can affect how she feels about life. It can give her pain. It can give her urinary tract infections. It's really important. And this type of surgery tends to be less important within the NHS and healthcare. And the sad part is it because it's surgery just for women? You know, we're underfunded. There was an amazing review done by the NHS Confederation towards the end of last year, I think, and it was, you know, looking at the gender health gap in the UK, and women are, you know, we live in poorer health compared to men. There are so many areas with regards to women and women's healthcare where we are just not as focused on as our male counterparts. You know, from the simplicity of a lot of clinical trials are just looking at men, not women.
And also, women weren't included in clinical trials until, was it the 90s?
It's insane, right? You're right. And, you know, you look at a lot of treatments that we have, and the treatments are not gender specific. So, for example, how we go about treating, I don't know, something as simple as high blood pressure. One has to question, does a woman's body respond the same as a man's body when you're giving the same drug at the same level? What happens when that woman's hormones leave? What happens when she loses her estrogen in menopause? How does that affect the condition that she's got? And we don't really have enough studies that say, or even look at this. You know, we're kind of still working it out as we're going.
Yeah.
And I can't stress enough that, you know, we're not, you know, women and men, you know, we're not the same. And, you know, women have uteruses, women go through menopause, men do not. And that does affect our bodies really differently. And, you know, 51% of the population is a woman, and 100% of that population will go through their menopause. Every woman or person with an ovarian system is going to go through their menopause, which means around 45 plus, they're going to go through a change. And, you know, let's just assume we're all trying to live to 100. That's a significant chunk of one's life where their health is affected and how healthcare is delivered isn't tailored. And one has to ask why not. And I think it's just because medicine's just gone, well, you know, it's probably the same. Just treat her the same. You know, women present differently with many things as well.
How do you think women can better advocate for themselves then? I mean, because not all GPs will be like you, who will want to investigate and will want to take that approach where we do a 360. Let's look at your lifestyle. It could be the bleeding. You know, I have friends who are getting an endometriosis diagnosis now through the surgery, but it's taken a good 10 years. So although there is way more awareness now, which is fantastic, and people are speaking about it more, and that's definitely, it's got to be helping people get their diagnosis. But how, for anyone who's struggling now, who has got several of the symptoms of something like this, or think they could be going through the menopause, but are not getting support from their doctor, what would you advise them to do?
So I think the tricky challenge is you're advocating for yourself. So you're thinking about, okay, you know, I've thought about my symptoms and I think I might have this. So let's just say, for example, I think I might be in perimenopause. This might be my menopause. And that might be a younger woman, because perimenopausal symptoms can start a decade before that woman's periods end. So I could easily have a woman in her late 30s, early 40s with symptoms of menopause. And a lot of doctors don't even recognize that is likely. And I'll misdiagnose her for years and years and years before it becomes more obvious. And so what I would say is, your challenge as a patient is saying, well, this is what I think it is. How do we explore that together? How can you help me? Because don't get me wrong, many symptoms could be a sign of many things. If you look at underactive thyroid, endometriosis, perimenopause, the symptoms can really overlap. So sometimes we're wrong and we think we have something and we really identify with the diagnosis, and that isn't actually the diagnosis. And I think, you have to go with the mindset that clinician should go on a journey with you to work out what this is. And irrespective of the diagnosis, how can that person help support you with your symptoms? So don't over focus on the diagnosis, is what I tell most women, because you may or may not have it, but that doesn't mean the healthcare professional can't support you and work out ways to make those symptoms better so that you genuinely feel like happier, healthier, etc. But it is important that you're validated, meaning that, if you come to me and say, look, I think I've got this, I'll say, well, you might. Tell me about it. Tell me about what's actually happening to you. Tell me about the symptoms. Tell me about how you've tracked them. And let's figure this out. How are we going to work out what this could be? Is it that thing that you've come and asked me about? Or I might say, but it could be 5 other things. Let's look at that. And I think, I would hope that every woman has access to a GP who will listen to them. Now, don't get me wrong. I think women's health as a even primary care general practice specialty is turning, there will be doctors who are more specifically in tune with women's health. Do I really believe that the healthcare of women needs to be a specialist interest when half the population are women? No, I don't. So do I think that actually, yes, I might have really super high level expertise in the management of menopause and certain, women's health conditions? Yeah, okay, I might. But I think the health of women needs to be something that every doctor sees as something that they need to understand, because this is not just about a specific condition. This is about our entire health journey. So I don't believe we should be over specializing the health of women long term. I don't think that women as a whole need to exist as entities of the gynecology department or of GPs like myself who have a special interest in certain aspects of women's health. I think every bloody doctor in the UK needs to understand women and needs to understand the things that make us different and how that affects their specialty. But I think the hard bit is if you do find that you've got a doctor, I'm using doctors as an example, but you might see a whole host of professionals. If you find they're just not listening to you or they're not taking you seriously, then I think your challenge is then going, okay, who can you recommend in the practice who might have more of an interest in this? And it's okay to ask that. It's okay to say, is there anyone, and actually the best people to ask are the reception team, who in the practice has an interest in this type of condition? Who would you recommend I see? And it might not even be a doctor. It could be a nurse, could be a paramedic. There could be a number of professionals working within your GP practice now who will have an interest in an aspect of healthcare. So ask. If you're getting a feeling that you're being brushed off, then don't be afraid to say, is there someone else you think would be better for me to see? And then you're going on a journey again, and I think that's the only way I can kind of encourage women to feel empowered to kind of navigate their health. I think it's dangerous in the private sector to start spending money because there's a lot of people that want to take your money, and to some extent I think there's so much good happening in the private sector, but at the same time it's the Wild West. A lot of what's happening in the private sector is not necessarily under the same governance, not necessarily under the same evidence base. So again, don't get me wrong, if you're seeing someone who's telling you to eat well, great. But if they're selling you lots of supplements that have no evidence and they're charging you lots of money for that, then I'd say, I'd rather you spend your money on good high level groceries or plants and vegetables in your garden than buy things that you probably don't need. So I think I would hope that your GP especially is going to help you kind of navigate what might be helpful. And so I signpost my patients a lot, and I do signpost my patients who can or who will consider paying outside of the NHS as well. I think we do lots of things really well, but there are some things we don't. And I think, there are some, practices where health coaching is part of, don't get me wrong, what I do is health coach a lot of the time, but, you might need ongoing health coaching. Yes. And actually that can really help someone, or someone might really need someone to just nutritionally help them work out how to shop and how to prepare food and support and encourage them to do that. And that can be a really helpful thing to spend your money on. And so
and that's the thing. I think sometimes we see these figures So I recently saw a functional medicine doctor, and I did a whole host of gut health testing, stuff that just isn't available on the NHS. And initially I saw the price and thought, oh gosh, like that's a lot, and I'd have to make other sacrifices. But in the long run, like, I've now got certain answers about things that weren't right in my gut, and I'm treating it. And I think if that is going to lead to like such better kind of health all over, then sometimes, I know it's hard when we're in a cost of living crisis and everyone's struggling, but sometimes I think you have to make the call where you're like, right, I've just got to try and do it and just see, if it's going to help.
I get it. I mean, it sounds really like corny, but health is wealth.
Yeah.
And I my patients who know me, I am pretty bantery. I'll be like, oh, you got nails done. I know how much that costs. How often are you doing that? And I'll be like, you could pay that. Don't do that for the next 2 months and take that cash and go and pay that one person, or invest in that one app that actually the paid version's really supportive. Or why don't you go and have that one session with the trainer so that you can do things at home? Like, so I do not underestimate how many of our patients live in poverty. Like we're talking in poverty. This is not just, they genuinely don't have disposable income. It's hand to mouth. So many of my patients live like that, but it's free to go outside.
Yeah.
You can get vitamin D from the sun. Vitamin D is so important for many aspects of our health, and you just got to spend some time outside. Everyone can do that. Everyone can go outside on a sunny day. Don't get me wrong, sometimes the UK is not that sunny, but you know what I mean. You can walk, hopefully. And if you can't walk and you've got a disability, you can be outdoors in some other way. You can buy a vegetable. You can prepare that vegetable. We are buying food, and the internet, not all patients in the UK, but most patients have access to it. And there's so much that's free, from how to move in your living room just using body weight. You don't even need equipment. I'm a bit obsessed with sandbags. You do not need weights if you want to get stronger at home. You can buy, you don't even have to buy sand. You can just go fill up a sandbag or a pillowcase and do some weight training with that. There are ways to do things that don't cost money, or very, very little money. So I think that private specialist healthcare might be inaccessible to many patients, but there are other ways to kind of get to where I might be able to help get that patient to. And I think, I am like this all the time. I want to try and find a way to invest in that patient so they really believe they can do it. And I think that's key. They need to believe that they've got the tools and the ability to do it. And it's hard. And actually sometimes your professional doesn't believe that they have the tools and the ability to do it for their own health, and I think it's tricky, because I'm not suggesting I'm perfect by any flipping means, but I get up every day and I try my best. And sometimes I achieve my goal and sometimes I don't. And sometimes my goal is just to get through the day and come home and smile and, eat and sleep and do all the basic things. But, I just think that patients, I think that they have way more power over their health than they realize. And I think what's hard is that we are in control of our choices, what we buy, what we do, how we live, how much time we spend online, how many hours we sleep. We have more control than I think we believe we have. And I think what's tricky is there's lots of people competing for us. There is lots of TV shows competing for our sleep. They want our sleep. They don't want us to sleep. They want us to watch.
They want your sleep.
They want our sleep. There's food companies that want us to buy the convenience food because they want to sell more of that thing, and therefore they're going to really push it. Don't get me started on vaping and smoking, and there are lots of things around us all the time competing for our attention. I joked about my dopamine brain. I have a part of my brain that's quite addictive, and caffeine is something I'm pretty addicted to. But there are lots of people that walk around with addictive type brains, and it's easy to get addicted to lots of things.
Yes.
And all those companies selling you those things, they kind of need you to get addicted so they sell more. So I think that we are, to some extent, in control of our long-term healthcare journeys. But more importantly, I think that people need to believe that it's their responsibility. And I think gone are the days, annoyingly and upsettingly to some extent, where your doctor's going to be the one telling you how to be healthy is gone.
Yeah.
Because you can't always access them as much. You know, the population is jumping, you know, investment into healthcare in the national service is not going up in line with population growth. There is just this huge gap. And then on top of it, you're a woman. And it's really tricky to kind of feel like you can get everything done. And I'm telling you already that we're not investing enough in women. So there's, you know, and if you live in a deprived area as a woman specifically, you have poorer health outcomes. So we have to go, right, what can I do? And what can I do for me first, you first? Women have to put themselves first, because you can't look after your family, your loved ones, your whoever, if you're not healthy and well. So what is in my hands? How can I do it? What's practical? You know, can I recruit my mum, my neighbours, my friends? You know, can we all go on this walk together? Can we actually go and bulk buy supermarket veggies together to make it cheaper and then share it out? Can we produce whole meals? I'll cook 3 different meals. You're going to cook 3 different meals, and we'll swap them, and we're going to have variety. There's so many ways to socially, in a really lovely way, live a healthier, happier life.
Yeah.
And it's just, I wish I could prescribe that.
I wish we could have more of you, because I love how passionate you are and how knowledgeable you are. And I feel motivated just talking to you. I am inspired by you on a daily basis. I love having you in my life. So my one wish is that we could just have more doctors like you who could be there in the community and help to inspire people. I also could talk to you all day, and I know you're a hugely passionate person about the menopause. You've got your women's wellness clinic. That's something you talk about a lot on TikTok. So I would like to have you back to do another episode on the menopause, if that's all right with you.
Amazing.
Because I think there's a lot more that needs to be spoken about in that field as well. But for now, that's all we've got time for, and I'm sad because I want to keep talking to you all day. But thank you so much, Dr. Reem. Can you just share your pages, so your Women's Wellness Clinic, the Instagram handle, and your TikTok as well?
Women's Wellness Clinic Doctors. You'll meet myself and Dr. Shields, my counterpart. That's on Instagram, and Dr. Reem on TikTok.
Amazing. Well, everyone subscribe, because you've got so much great information to share. Thank you.
Thank you.